Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Here is what I bring to you from the world of medicine. Better use of vaccines could reduce antibiotic use by 2.5 billion doses annually, says WHO. A new report by the World Health Organization finds that vaccines against 24 pathogens could reduce the number of antibiotics needed by 22% or 2.5 billion defined daily doses globally every year, supporting worldwide efforts to address antimicrobial resistance. While some of these vaccines are already available but underused, others would need to be developed and brought to the market as soon as possible. Antimicrobial resistance occurs when bacteria, viruses, fungi and parasites no longer respond to antimicrobial medicines, making people sicker and increasing the risk of illness, death and the spread of infections that are difficult to treat. Antimicrobial resistance is driven largely by the misuse and overuse of antimicrobials, yet at the same time many people around the world do not have access to essential antimicrobials. Each year nearly 5 million deaths are associated with antimicrobial resistance globally. Vaccines are an essential part of the response to reduce antimicrobial resistance as they prevent infections, reduce the use and overuse of antimicrobials, and slow the emergence and spread of drug-resistant pathogens. The new report expands on a WHO study published in BMJ Global Health last year. It estimates that vaccines already in use against pneumococcus pneumonia, Haemophilus influenza type B and typhoid could avert up to 106,000 of the deaths associated with antimicrobial resistance each year. An additional 543,000 deaths associated with antimicrobial resistance could be averted annually when new vaccines for tuberculosis and Klebsiella pneumoniae are developed and rolled out globally. While new TB vaccines are in clinical trials, one against Klebsiella pneumoniae is in early stage of development. Addressing antimicrobial resistance starts with preventing infections, and vaccines are among the most powerful tool for doing that, said Dr. Tedros Adhanom Ghebreyesus, WHO Director General. Prevention is better than cure, and increasing access to existing vaccines and developing new ones for critical diseases like tuberculosis is critical to saving lives and turning the tide on antimicrobial resistance. Vaccinated people have fewer infections and are protected against potential complications from secondary infections that may need antimicrobial medicines or require admission to hospital. The report analyzed the impact of already licensed vaccines as well as vaccines in various stages of development. Earlier, vaccines against Streptococcus pneumoniae could save 33 million antibiotic doses if the Immunization Agenda 2030 target of 90% of the world's children were vaccinated as well as older adults. Typhoid could save 45 million antibiotic doses if their introduction was accelerated in high-burden countries. Malaria caused by Plasmodium falciparum could save up to 25 million antibiotic doses, which are often misused to try to treat malaria. TB could have the highest impact once they are developed, saving between 1.2 to 1.9 billion antibiotic doses, a significant portion of the 11.3 billion doses used annually against the disease covered in this report. If vaccines could be rolled out against all the evaluated pathogens, they could save a third of the hospital cost associated with antimicrobial resistance. A comprehensive, people-centered approach applied across health systems is needed to prevent, diagnose and treat infections. This approach recognizes vaccinations as core to preventing antimicrobial resistance and especially impactful when combined with other interventions. At the 79th United Nations General Assembly high-level meeting on antimicrobial resistance, world leaders approved a political declaration committing to a clear set of targets and actions, including reducing the estimated 4.95 million human deaths associated with bacterial antimicrobial resistance annually by 10% by 2030. The declaration emphasizes key aspects including the importance of access to vaccines, medicines, treatments and diagnostics, while calling for incentives and financing mechanisms to drive multi-sectoral health research, innovation and development in addressing antimicrobial resistance. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.